Welcome to the deep dive. Today, we're actually jumping back to the mid-1950s.
Yeah, a really fascinating time.
It is. We're looking at a field that was, well, just finding its feet, medical sociology,
Mhm.
and we're going to unpack a really key paper from 1957 by Robert Straus. It's called The Nature and Status of Medical Sociology.
Foundational text, really.
Exactly. So our mission today is to explore what this field looked like back then, who the early players were, what they were actually doing.
And the challenges they faced, which were quite significant, defining their whole contribution.
Yeah, what's interesting is we're basically getting a snapshot of a discipline trying to figure itself out.
Absolutely.
Yeah.
How it defined itself, its value, and honestly, there are lessons there that still resonate today, I think.
Totally. So, okay, let's dig in. This whole thing kind of started with a problem, didn't it, back in 55?
Right. A small group, some sociologists, some physicians, realized they needed a better way to connect.
To share ideas, avoid problems in this new area?
Exactly. Which naturally raised the question, who were these medical sociologists?
So Strauss did a study in 56 to find out.
He did. He surveyed 110 people who identified primarily as sociologists. And get this, the response rate was huge.
Oh, really?
Yeah, 89%. It shows just how much they, wanted to be identified to be part of this emerging thing.
Wow. Okay. So where were they? Where did they actually work?
Well, the study found about 60 of them had a clear medical focus. So medical schools, hospitals, government health agencies.
Places like that.
Yeah. But interestingly, a fair number, 34, were still based mainly in standard academic sociology departments.
And others were in, like, private research or foundations?
Right. And importantly, 68 were already doing this full-time. Medical sociology was their main gig. Shows real commitment, even that early.
Okay, so they're committed. What were they actually doing? What were their main jobs?
Two main things really jump out from Strauss's work, teaching and research. 57 mentioned teaching, but a massive 108 listed research. Some did admin too, but teaching and research were the big ones.
Let's focus on the teaching for a sec. Who were they teaching?
A pretty wide range. Medical students, obviously, but also nurses, public health students, even undergrads.
So trying to get sociological ideas into medical training.
Exactly. There's this example of medical students learning the science of human behavior, an interdisciplinary course.
What was the goal there?
To give medical folks a, quote, broader perspective for understanding some of the social and cultural factors behind health and illness.
Contributing to that idea of comprehensive medicine, looking at the whole patient.
Precisely. More holistic.
And the research, you said 108 were involved in that.
Yeah, Strauss cataloged something like 135 different studies they were working on. It was pretty varied.
Like what? Give us some examples.
Well, a lot focused on mental illness, how psychiatric hospitals worked, for instance. Were they actually therapeutic communities?
Okay, interesting.
Others looked at, how people respond to being ill, how different cultural groups might use doctors or hospitals differently.
Or maybe social factors in specific diseases.
Yes, like heart disease or alcoholism. And they also studied the medical profession itself.
How doctors become doctors.
Sort of, yeah.
Yeah.
Or how medical students are socialized, or just the basic organization of hospitals, or how health resources are spread out in a community.
Okay, so lots of activity, teaching, research. Sounds like the field was really taking off, but there was a catch, right? Regarding its status.
Yes.
Yeah.
The long-term viability question, that's where it gets really interesting.
Because lots of medical schools were hiring sociologists.
Right, but, and this is a big but,
Yeah.
it was often funded by outside money, foundations. Strauss specifically mentions the Russell Sage Foundation.
Which was a major supporter of social science back then.
Absolutely key.
Yeah.
But the real test, as Strauss pointed out, was whether these schools would eventually fund these positions from their own budgets.
And had they started doing that by 1956?
Very few, apparently. Which really highlights that tension, A new field trying to get properly established, institutionalized. It needs more than just temporary grants.
Yeah, that makes sense. And then there was this whole identity issue.
Oh, yeah, the identity crisis.
Yeah.
Strauss made this really important distinction
Between.
sociology of medicine and sociology in medicine.
Okay, what's the difference?
Sociology of medicine is more like studying medicine from the outside as a social institution, using sociological theory, but keeping some distance.
Independent.
Right. And sociology in medicine.
That's more collaborative. Working within the medical setting, doing research with doctors, or teaching medical students directly. Applied work.
And Strauss thought these might even be incompatible.
He suggested they could be, which is pretty strong. It points to this real dilemma for the people working in the field.
Which leads to his chameleon idea.
Exactly. The chameleon analogy. The idea was that a medical sociologist working in medicine had to adapt.
They had to translate complex sociological ideas into language that doctors and nurses would understand and find useful. Practical terms.
But without dumbing it down or losing the unique sociological perspective.
Precisely. It's a really tricky balance. Use too much jargon, nobody listens. Assimilate too much, and you lose what makes your contribution valuable in the first place. You just become another helper, not a sociologist offering a distinct viewpoint.
Wow. Okay, so wrapping this up, what's the big takeaway for us, for you listening?
Well, looking back at 1950s, medical sociology isn't just a history lesson, right?
No, it really shows this complex dance that any new field goes through, especially interdisciplinary ones,
Yeah, carving out space, finding funding, defining who you are.
and figuring out how to talk to people from different professional worlds. That communication challenge is huge.
It really is. And it makes you think, doesn't it? How do new fields today, especially ones that cross different disciplines, establish their worth?
And how do they hold on to their unique identity when there's always pressure to adapt, to fit in, to meet the expectations of established environments?
That's the lingering question, I think. Still very relevant.